The KwaZulu-Natal government says it is addressing the issue of service providers' non-payment by the Departments of Health and Education, which could affect service delivery, including the school nutrition program. The Department of Health has confirmed that it owes $1.7 billion to businesses in the province with over 1,500 unpaid invoices. The non-payment of suppliers is said to have left several schools without food for learners. Both departments have attributed the delays in payments to budget cuts, technical glitches, and non-compliance on the side of service providers. Premier Ntuli addressed the media after the weekly Executive Council meeting. All our provincial departments will continue to work around the clock with National Treasury to resolve any failures in the technical system. We can assure the public that the Department of Education has full records of all unpaid service providers. On the other outstanding invoices by the Department of Health, we also wish to condemn the barricading on Monday of the officers of the Department of Health by disgruntled service providers. No dispute, however big, should be resolved by violence in KZN, says Ntuli. Ntuli says while he acknowledges the inconvenience caused, he has encouraged departments to empower service providers to have savings to sustain the service. Summary of the KwaZulu-Natal Service Provider Payment Crisis. The KwaZulu-Natal government is working to resolve non-payment issues affecting service providers in the Departments of Health and Education. Department of Health owes $1.7 billion to businesses, with over 1,500 unpaid invoices. Impact: the failure to pay suppliers has led to disruptions in services. Some schools are left without food for learners under the school nutrition program. Departments cite budget cuts, technical glitches, and non-compliance by some service providers as reasons for the payment delays. Premier Ntuli addressed the media, assuring that departments are working with National Treasury to resolve technical system failures. Education Department has full records of unpaid providers. He condemned the barricading of health department offices by frustrated service providers, calling for peaceful resolution of disputes. Encouraged departments to help service providers build financial resilience, e.g., savings to sustain operations during such delays. Key concerns: service delivery disruption. The school nutrition program is directly affected, putting vulnerable learners at risk. Financial strain on small businesses. Prolonged non-payment threatens the survival of service providers. Governance issues. Raises questions about procurement processes, compliance monitoring, and financial management. Social tension. The barricading of government offices shows rising frustration, hinting at potential civil unrest. Possible solutions/policy considerations. Immediate release of emergency funds to cover critical unpaid invoices, especially for services affecting health and education. Process audits to identify technical or administrative bottlenecks in the payment system. Capacity building initiatives to help small service providers comply with procurement regulations. Improve communication between departments and suppliers to prevent escalation of tensions.